Good evening. It's my pleasure as Dean of the Knoxville chapter of the American Guild of Organists to introduce this evening's presenter, Dr. John Orr. Dr. Orr is a Tennessee native, having grown up in Nashville. His degrees are from William Jewell College in Missouri. His master's is from Southern Seminary in Louisville, Kentucky, and he has his doctorate from the University of Alabama, where the subject of his dissertation was the effect of aging on the human voice. So with these impressive credentials, he will be a wonderful person for us to have for this evening's program. Further, Dr. Orr is the Director of Music at Tellico Community Church in Tellico Village, and is the Director of the Knoxville Choral Society, where he has succeeded Dr. Eric Thorson. You can find more information about not only our chapter, but upcoming programs on our chapter website, www.agoKnoxville.org. And again, it's our pleasure to have Dr. John Orr with us this evening.
Good evening. I'm John Orr, and I'm coming to you from my church office here at the Community Church in Tellico Village. And I thank you all for inviting me to be part of your meeting tonight and talk about something that I feel like is really important and I have a passion for, and that is aging voices and the church choir. And I am not an absolute expert on these areas, but it got me started with this when I was in graduate school. And my father, who at that time in his life was in his late 70s, would often come to me and say, "John, I'm singing in the choir and my voice just isn't doing what it used to do. I have this problem and I have that problem. What do I do to fix that?" And at that point in my career, I had no idea what to tell him what to do to fix that or why it was happening or anything else like that. And so it did sort of spur my interest. And as I progressed in my education and got to the point of having to choose a topic for my DMA dissertation, I decided that I would look into this further and make it something that I could really know something about, not just to help my dad, but to help me and any other choral conductor who is dealing with aging voices in their choir. It got to the point where I was approved for that as a document, and I was doing a research project based on some exercises called vocal function exercises, which really come more out of the voice therapy side of things than they do the music studio side of things. And so it got a little pretty technical and medical, actually. And at some point early in my writing process, the university music department decided that I would be better served if my document advisor wasn't one of the music faculty, and they actually moved me over to the chair or the head of the department in the speech pathology at the University of Alabama. And so together we sort of worked and came up with this experimental research project that, like I said, got kind of medical and kind of technical, but I'm going to try not to dive too deeply into that sort of level of things tonight. I'm going to keep it on a level where we are sort of as choral directors, though I will talk a little bit about some of the physiology of what's happening in our bodies as we get older and how that affects the voice. Since that time, I've been here at at Community Church in Tellico Village, and as many of you know, Tellico Village is what they call an active retirement community. It's marketed to all over the country, and people come here from all over the country for the golf course and the lake and the activities center and those kind of things. So our church has been here about the 30 years that the village has, and I have a choir of about 85 singers on the roster. And we joke that that's about their average age too, but it's actually maybe a little younger than that. But they are almost all retirement age of 60 or older. Recently, we're getting, as the baby boomers are starting to retire, we're getting a few more that are in their late 50s and even a few that are still working. But the vast majority, 96-7% of our congregation and the choir are over 60 and even into their 70s and 80s and sometimes 90s. So in the almost 11 years that I've been here working with the ensembles, it's been a little bit of a lab for me to take what I did as research project for my doctorate and begin to kind of see how that works in the real world. And that's sort of some of what I want to share with you tonight. We'll discuss a little bit about what we know is happening to the voices and the bodies as we get older and how that affects us in our singing. And I'm also going to discuss what those changes, the challenges that those changes create for us as choral conductors in our ensembles, and give you some strategies for some of the things that I do, as well as some things that I know that other people do, and some things we can do to deal with those in our choirs, and some things to think about when you're dealing with aging singers. And then I'm going to go briefly into the specific set of exercises that I did my research on. And again, I'll just be sort of top level about that, but I did produce a handout that will give you some of the resources that let you look into that further if it's something you would want to do, that I think will be available to download either now or as soon as this presentation is over. But we need to talk for a second about the demographics. It's why we're dealing with this. Most of us have or will have singers in our choirs whose singing voices are being affected by aging, and that's basically just because of the demographics and the population trends make it almost inevitable for anyone who deals with volunteer choirs, which is most of us. I think back to the original Chorus America study back in 2006 that sort of labeled, or they came up with, they thought there were about 250 choirs in America at that time, and 200,000 of those were church choirs, and another 20 or 30,000 were community choirs. And so if you're dealing with volunteer choirs, unless you have some sort of restrictive age limit in terms of what you are dealing with in your musicians, you're going to have people who are dealing with aging voices. The population itself is moving in that direction. Studies are showing that over the last 4 decades, the average age of a choral singer in America shifted from being below age 45 to above age 45. Now, not that 45 is old. Don't hear me that 45 is old, but it is an age at which we start to experience some age-related changes in our body and our vocal mechanism. Don't be offended. I don't mean to call anybody who's 45 or older old, because that includes me. The population is aging to the point where it's becoming a larger segment of our population. And I'm going to read you a little quote here. The current growth in the number and proportion of older adults living in the United States is the highest it has been in our nation's history. And there's 2 factors primarily. We're living longer, and then we've got this group of aging baby boomers that has basically doubled the populations of American age 65 or older over the last 20 years. The life expectancy in the U.S. has increased from 47 years old for people who were born in 1900 to 77 years for those born in 2001. And the baby boomers, who born between 1946 and 1964, started reaching the age of 65 in 2011, and it's expected by 2030 the number of older Americans is expected to reach about 71 million, or roughly 20% of our population. That's a lot. And they're choral singers. They sing in choirs more often than the younger people do, sadly, for our younger generations. There are some trends that are showing that that is changing, and I'm glad to hear it. The church musicians are primarily the ones who've dealt with the aging voices in their choirs. In a way, we were out ahead of the academic community in dealing with it, and how what do we do and what are the approaches we can take for dealing with older singers in our choir. And I wanted to just highlight one of the very first books that was ever written about it. Was called Senior Adult Choir Ministry by Lyndall Vaught, and it really wasn't that long ago. It was 1991 publication, and it went into sort of what really is happening with the voices as these singers get older, as well as ways that the church can be a part of their singing process. And it was the church musicians who were looking for the answers to this way more than the academic community. And I think that's probably because so much of the academic community very often is dealing with age-limited choirs in colleges and universities, and so they weren't seeing the problem as much as we were. But that has since changed, and over the last 15 to 20 years or so, lots more research has gone into the effect of aging on our voices. So we all have these issues with church choirs and volunteer choirs about these singers and who are reaching age levels and vocal production levels that are creating issues. And so what is it that we do? And I think basically, from what I know, there's basically three approaches that I've seen from my colleagues and choirs around the country. The first is the age out approach, and that basically means this is the age that you can be in this choir, and once you reach that age, you can no longer be in this choir. And you all know of choirs that are like that, I'm sure. And that is a philosophy that you have. It depends on what your goals for your church choir are and what is expected of you performance-wise, and really what your philosophy of church music is, if that's the approach you want to take. It's not one that I particularly like, but I know that there are churches that do that. My only advice about that is when you do that, you want to be very transparent about it. You want to be very deliberate and consistent with what that is, because as our singers get older, they get anxious about what's happening in their voices. And a lot of them will self-select. They'll preempt you. They'll come to you and say, my voice is shot. I used to sing and now I just can't do it anymore. And so they'll pull themselves out of an ensemble when they might have years of singing still ahead of them where they could contribute and benefit from being in the choir. So I would just say, if that is the approach, to have an age out, just be consistent with it. Set the date and the age that you're going to do, and then definitely you want to celebrate those people who are at that age out place and the service that they've given over the years. Let's see, the other approach, and I don't see this as much as I used to, but I see it in a lot of places over the years, is the senior adult choir. And it's just a separate ensemble for people who reach a certain age, or and you set that age or development stage in their life, and that's what they do. And it has some real advantages, and I think that's something would look at. One of the first advantages of a separate senior adult ensemble is you have the opportunity to effectively address the vocal issues as a group. And sometimes you can deal with things that are happening vocally, or exercises that you may want to do that you wouldn't do with a younger choir or a group of professional singers, and those kind of things, who you just, they come and they're going to be ready to go. You also then have the ability to tailor the repertoire and your rehearsal strategies. In church situation, the senior adult choir becomes a smaller group ministry for your senior adults, which is a part of their social interaction with the church, which is really important for senior adults. It gives you a greater flexibility in terms of rehearsal and performance times, even just within the time of day. One of the great things about working at the community church in Tellico Village is we have no nighttime committee meetings. As long as we stay away from their golf times, we can have our committee meetings and our rehearsals anytime during the day, and almost all of them happen during office hours. And so I've always enjoyed that. And it's certainly something you can do when you're dealing with retirees or a senior adult choir. It gives you the opportunity to be flexible about performances. If the senior adult choir is not your primary worship leadership choir, then you can have them sing once a month and give them a little longer to prepare what they're going to do, or whatever schedule you come up with. And you can then also, post-COVID, and when we are able to get back to these kinds of things, the senior adult choir is available during the day to go to nursing homes and to sing at the mall or outside things that allow you to use it as an outreach to the community from part of your music ministry's overall outreach to the community related to your church. And I just think that gives you a lot of flexibility. The disadvantages of a senior adult choir approach is that, quite frankly, your church may not be large enough to support 2 choirs. And related to that, your primary worship choir may have already become a senior adult choir just because of who's in it. And so you don't want to have to create something that's separate from that, because you've kind of already got it, even though you didn't mean to. And that's something a lot of us deal with in any kind of church that you're in. But I also think the disadvantage is that the mix of ages in a choir is good for the choir, because the older singers provide leadership, they provide spiritual leadership, musical leadership. They're very committed, much more so than some of the young parents in the church choir can be sometimes. You have a lot of different things pulling at them that keep them out of rehearsals and things like that. And they're just experienced musicians. They help. If you're doing a master work and you've got singers who've sung it 3 times over their life, and then you've got college students who've never sung it before, it's great to have the people in the ensemble that can help teach it quickly. And that's one of the good things that experienced singers bring to an ensemble. So I think that's a good thing. And when you have just the senior adult choir, you lose the interaction of the generations. I think was the point I was trying to make in terms of it being a disadvantage. Finally, you're going to have some that are just going to be reluctant to join the senior adult choir unless you're very careful about how you market it. I remember when I was just starting the research on this, I had a conversation with Dr. Vaught, who wrote that book I showed you a minute ago. And he said that he thought churches would be trending away from the senior adult choir concept, primarily because of baby boomers' self-identity or their own self-concept. He said to me that baby boomers will not join anything that classifies them or makes them feel old. And I think I agree with him after seeing that happening over the last few years. The other thing is that we have to be aware of what's happening with vocal aging in our ensembles, because like I said before, it starts in your mid-40s. And so there's not a number date that you can say this is the age that people are going to be dealing with vocal problems because of aging. It's going to be different from everybody. And of course there's a scale, and it's going to move up as the age of your singer does. But just putting an arbitrary age down and saying you got to move to the other choir might not be the best way to do that. The benefits of participating in a choral ensemble are still something that's, I think science and research is showing more and more. And if you follow any of it, you're seeing more and more of the research that's showing what good being in arts organizations and choirs is doing for us in terms of our mental and physical health. It's especially true for senior adults and people who are getting older. In the church, I think it's important that lifelong worship leadership is something that we need to honor. These folks have been in choir for years and years. They've given countless hours to the church and to the worship of the church and rehearsals and special programs and Sunday mornings. The choir is very often the group of volunteers that meets more than any other group and gives more hours to the church more than any other group in the church. And so it's something that we need to honor among our members who are older in the choir. It is a huge social outlet for people who are retired and who aren't getting up and going to work every day. And I bet you've probably experienced that if you've been shut up in the last few months in your house, how much we miss that. And then you think about that for the people who are just retired. And so they need to be involved in these activities. And the church choir is definitely one that provides for them a social outlet. I also think it's a way we can affirm, and the church at large can affirm the gifts that they've been given by God. The choir affirms their worth to you as a person and to the church as a congregation and to each other. They value seeing each other. They value knowing that they're part of something that is making a difference in your congregation. Music is also, we know, it is lifelong. It is loved and recalled even in people of dementia. And I remember when I was young and just beginning music ministry, I used to go to an adult day center that took care of people during the day who were experiencing dementia. And one of the things that always struck me is that these were a group of people who really couldn't necessarily tell me their name. They didn't have very good conversational skills, if at all. They didn't know what day it was, but they could sing every verse of some of the hymns that we would sing with them, and they remembered it, and they had emotional connection to it. So the idea of music being something that is one of the last things that people with dementia actually lose, and some of them never lose it, but they still have both cognitive and emotional connection to music. That's spiritual in my mind. I pray that that's something that God has just gifted us with as a mercy during times like that, and for people who are suffering from that. We'll talk a little bit more about some of that, but there are let me save that. I'm going to talk to you a little bit about dementia and how that affects being part of a church choir, and my experience with that. Let me read something real quick because I thought it was really important. There was a creativity and aging study that was done back in 2006 by the National Endowment of the Arts and George Washington University, and I just wanted to read a little bit about what they found in this study. Senior adults over the age of 65 who participated in weekly arts organizations were compared with those who did not participate in such a group. One of these organizations was a choral group, the Senior Singers Chorale, based in Washington, D.C. area. Results from this group showed the following. After a year, those participating in the chorale reported an increase in overall health, while those in the control group reported a decline. After 2 years, those in the chorale reported stabilization in overall health, while those in the control group reported a decline. Those in the control group reported a greater increase in the number of doctor visits than those in the chorale. Those in the control group reported a greater increase in the number of prescription medications utilized than those in the chorale. Those in the control group reported a greater increase in the number of over-the-counter medications utilized than those in the chorale. Those participating in the chorale reported a decrease in falls, while those in the control group reported an increase. Participation in the chorale had a more positive impact on morale than being part of the control group. Over a 2-year period, those in the chorale improved on a depression assessment, while those in the control group did less well. Over a 2-year period, those participating in the chorale reported an increase in the total number of activities they were involved with, while those in the control group reported a reduction. And here's the conclusion by one of the study's authors, Dr. Gene Cohen. Asserts that the arts and creative expression promote health with aging in 4 primary areas: the sense of the control mechanism, influence of the mind on the body, social engagement, and brain plasticity. Research shows that the health is impacted positively when senior adults are engaged in activities in which they experience a sense of mastery, and that this sense of control encourages comfort in exploring new challenges. Cohen writes that in the arts, the opportunities to create something new and beautiful are endless and offer an enormous sense of satisfaction and empowerment. This sense of well-being associated with mastery has a positive effect on the body as a whole. I thought that was really fascinating, and that research is 15 years old now, but it's ongoing, and you can find lots more studies like that, not just for those who are older, but for us as well. It kind of brings me to the conclusion that, in my opinion, as churches, we need to allow for and provide ways for senior adults to sing for as long as they want to and are able to. I just think that should be part of the ministry of our church music programs. Let me shift for just a second and talk a little bit technically about some of the things that we know are happening to our voices as we begin to age, and how, where the problems are coming from, because they primarily relate to respiratory, breath, respiratory and breath, are the range of the voice, and then the one that I bet you are all trying to figure out, is John going to tell me how to fix? Vibrato. Those are the things as choral conductors that we kind of hear, is that there's that problem voice, and a lot of times it's related to the vibrato. But let me dig a little deeper about what's happening with the voices. As far as the respiratory changes, as we get older, we lose elasticity in our lung tissue. And there's a decrease in the capacity of air in our lungs by as much as 40% from the time we're age 20 until we turn 80. There's an increase in connective tissue in the alveoli, which are the small air sacs that are in your lungs. And what that does is it decreases the ability of our lungs to expand as we breathe. And so basically what's happening is we're not able to expand our lungs as much. We don't take in as much air as we get older because of that decrease in ability. The body thorax, which is basically from your neck down to your waist, that part of your body experiences changes as well. Our ribs, the calcification of the lower ribs stiffens them up. There's stiffening of the chest wall, which are the muscles up here. Our posture changes, and we preach about posture to all our singers because of how it decreases our ability to expand and inhale. And when you're dealing with older folks who are kind of already hunched over, ask them to sit up straight, and you're not going to get the same result as you do, for younger people who can make that opening motion with their staff, with their chest. There's a decrease in the thoracic elasticity and respiration volume, which again just means we're not able to inhale as deeply and take in as much air. And what that does is it decreases the breath support used for phonation. It reduces what's called maximum phonation time, which in our terms means how long can you sustain a phrase or a particular note before you have to take a breath again. And so that's something that a lot of the older singers are dealing with. Oh, let me an aside here, because I discovered a book that just came out, sort of related to this. It came out this spring, and it's called Breath: The New Science of a Lost Art by James Nestor, and it's really interesting. It's kind of funny. It's written by a reporter who went through this sort of study about breathing, and he's basically talking about how we as human beings have devolved into a situation where we just don't breathe the way we need to breathe, and how it affects our body. So if you want a good book to read, that's not really a music book but has some great insight into breath, that's the title of it, Breath: The New Science of a Lost Art by James Nestor. And I wrote a note over here that I wanted to make sure to mention that to you, because I think it's really good read that's sort of an aside. The larynx, we think about the larynx, the lay term is the voice box, is this part of our body, and everything that holds the vocal mechanism. That's where a lot of the changes happen that affect the sound of the voice as we get older. They begin to appear in men really in our mid-30s. We kind of think the male voice is mature at that age, and it increases to substantial levels as we get over into our 50s and 60s and older. For women, the changes are not as pronounced in the laryngeal muscles and bones until later, usually around the age of 50, which you can probably guess what may have to do with that. Here are some of the primary changes. Calcification, which means it's a hardening due to calcium buildup in the soft tissue. Ossification, which is actual creation of bone of the cartilages that affect the vocal adduction. And adduction just means that's adding, brings the vocal folds together, which is that's adduction, and that's what creates the sound, allows the sound to create. Atrophy is a decrease of mass in the muscles and loss of muscle fiber in the larynx, and that affects the stability of your fundamental frequency, which is basically the pitch at which you talk, the pitch of your voice. And it also affects the intensity, or how strong your voice is, and it again affects the sustained phonation. How long can you sustain a sound? Changes in the layers of the vocal folds. Vocal folds are what we often call vocal cords, and they basically have 5 layers of tissues. And I won't go into naming all of those. You can look up what those are. But this the changes that occur as we get older is that those vocal fold layers begin to thicken and stiffen. The tissues are stiff. It's just not as flexible as it used to be, like a lot of the muscles in our body as we get older. There's changes in the mucosal glands that are responsible for keeping the vocal folds hydrated and lubricated, and the vocal ligaments themselves begin to lose the elasticity that they used to have, which affects how they come together. I'm trying not to use my hands too much, but I just tend to talk with my hands sometimes. If you know that the vocal folds adduct or come together and creates the vibration that creates sound when we phonate. This opening in between them is called the glottis, and what happens as these changes and deterioration occurs is sometimes called glottal gap, and it just means that they don't come together far enough, or they leave a little gap somewhere in the adduction, and so there's basically what happens is air is escaping, and it creates a hoarse sound, it creates a breathy sound. A lot of times it creates a strain. The muscles, the laryngeal muscles, will actually try to overcompensate and press it together too hard, which creates a strange sound, and discomfort, and the tension that we always try to get out of our singers happens because of that glottal gap that's created by the lack of elasticity in the vocal folds themselves. And it's going to reduce again the maximum phonation time. Just because you're letting air escape, it's not being used efficiently, and so that reduces how long you can sustain the sound. There are also changes in your facial bones and your facial muscles as you get older. There's change in the articulators as well. The muscle function, the jaw muscles, even the tongue can decrease in strength. Then there's the teeth, or the dentures, or whatever the case may be, and those don't directly affect phonation, but they can certainly affect the singing experience. If you got a sore tooth, or you're trying to keep your dentures in, or other things that create a different feeling in your mouth. And then there's a loss of up to 25% of your salivary function, which is your spit, basically. And so as our singers age, we need to encourage them to drink more water, because dry mouth just occurs more often because their saliva glands don't function the same way they did as they were younger. As we get older, there's a change in the fundamental frequency, or the speaking pitch of the voice, and that's different for everybody. But what research has found is that it gets lower as one ages, and then tends to rise in advanced age. And you can hear that if you hear the voice of a teenage boy whose voice has changed. It has that higher, younger sound, and then a middle-aged man can have the deep, resonant voice. And then when they get to very elderly, their voices get even higher. If you see an actor or somebody trying to imitate a really old man, they're going to talk up here, young whippersnapper, because that's what we hear. And that's literally what happens to, especially in the men's voice, as they reach the, into the what you classify as elderly, in the 80s or higher. The lowering of the larynx in the vocal tract happens just because of the change in the bones, which can contribute to a loss of resonance, because you've moved You've moved for the sound source further away from the resonance part of the vocal process. And then range. Range is the highness and lowness of how much of an individual can sing. It becomes more restricted as one gets older. Middle-aged and older women are going to experience an expanded low-frequency range and a restriction of high-frequency phonation compared to younger women. Men, the restriction is generally in the high-frequency range. So when you think about your choirs, you're hearing more problems with your tenors than you will with basses, just in terms of range in most music. The other thing I wanted to mention is the effects of medication, and there's tons of research on medications and how they affect our bodies and the voices and things like that. And I just want to primarily think about a few, but I'm putting in the handout a website that actually lists hundreds of different medications by name and what their effect is or is not on the voice. And I think it's a great thing, because that is actually something that a lot of people ask me about in my senior adult choir here is, is there something I can take? Is there something I can spray in my throat? And those kind of things. And reality is that a lot of those things do more harm than good. But even common medications like aspirin, regular use of aspirin, which a lot of older folks take for circulatory issues, creates a fragility in the capillaries of the vocal folds that can result in a hemorrhage. And a vocal hemorrhage, when you strain too high, too much subglottal pressure to get that high note that you shouldn't be trying for, can create a vocal hemorrhage, which is painful. And you're out for at least 2 weeks, or however long it takes your body to heal a bruise on a vocal cord. And that's just regular old aspirin. But we all know the effects of antihistamines and decongestants and how they create a drying of the vocal folds. Throat sprays and lozenges. My choir loves to have their little lemon drops and things that they're sucking on all the time before rehearsal and stuff. But a lot of those have benzocaine in them, which creates in many people an allergic response in the mucous membranes. So they're actually gumming up the works worse by sucking on the throat lozenge than if they just get a drink of water or something. Sleep aids can create issues in dehydrating the mucous membrane. Even vitamin C in large doses has a drying effect on the vocal tract. And of course, we know social drugs like marijuana and alcohol and tobacco are negative for the voice. And then chemotherapy is one of the other big things. And I remember one researcher said chemotherapy used to treat cancers will almost without exception have vocal and laryngeal masculizing effects because of the hormone medications used as part of chemotherapy regimens, such as androgens, can cause irreversible changes of timbre, unsteadiness, and a lowering of the fundamental frequency, especially in women. Which, now that we're talking about hormones, let me move quickly to the hormonal issue that we deal with primarily with older singers, and that's the endocrine system associated with menopause. There's an increase in the systemic androgen, which causes that lowering of the fundamental frequency and the loss of estrogen in their system. Many times will compromise the mucosal lining of the vocal folds and change, all of the muscles of the body. In men, there's a loss of testosterone after age 50, and that can raise the fundamental frequency in the voice. So, that's not always as much of a problem, but they will notice that their voice is different. And a lot of times that's something that you can identify. The more practical ones, hearing and seeing and the mental changes that take place as we get older, those are the things that we primarily as the conductors are going to notice. The term presbycusis is the gradual loss of hearing associated with aging. and it's especially in the higher frequencies, and the reduction of the nerve endings and the cochlear of the hearing mechanism is they can't hear the overtones. They can't hear the high frequencies that let them recognize the speech, and so it's often accompanied when they have the hearing loss. It's just age related. It's often accompanied by a need for increased time to assimilate the auditory information that's coming at them. That affects your rehearsal. It affects your instruction speed, how fast you can talk and give instructions, the tempo of how fast you move the rehearsal, and whether or not you need to use a microphone. And a lot of times, the choir here, I use a little headset microphone, but I've still got some that I know can't hear what I'm saying. And it's really not so much that they can't hear me, it's they don't understand me because they don't hear the high frequencies that allow us to understand speech. And so a lot of times when I'm dealing with my choir, if I say, let's go back to page 7, measure 32, there's going to be that pause that you give any choir to find that. But I just know there's a dozen people in my choir that are going to lean over and say, what did he say? And then there's the time to, well, it's here, it's right there, it's on that page. And so I know I can't just go bang, bang, bang and start up, or they're going to be way behind. Okay, so it does mean that you have to give a little more time, speak clearly, speak slowly, give a little more time for the actual processing and assimilation of the auditory sounds that they hear. And because of that, it also then affects, pitch control, intonation, and rhythmic accuracy. Pitch control happens as a problem when they can't hear themselves as well. And of course, that happens to us too. If you've ever recorded yourself singing when you had headphones on, or somebody else recorded, or the microphone picked you up while the organ was blaring, it doesn't always sound too good because we really rely on our ears, both inner and the outer sounds, to do our own pitch control and tone, intonation, and things like that. One thing that you'll notice with senior adults is that they'll often overcompensate when they don't hear well and they sing too loud. And so you have to be able to gently, back people off. And I don't mind back people off individually. Al, that's too much. John, I need you to back off. Susan, a little less there. And I think, they respond to being treated that way if you do it respectfully. But you'll notice it over and over. The ones you have more trouble hearing will sometimes just sing louder, and that's something you have to deal with as a choral musician. The visual side of it, you've got to get them time to find where they are in the music. If you can use large print music, I've noticed lately that J.W. Pepper often is offering large print editions of some of the music that they publish, and it's helpful, and they really like it. Other times you can blow it up on a copy machine for individuals that allows them to see it better. And the most important thing probably, though, is adequate lighting, because as their vision goes, they just need brighter lights. And unfortunately, a lot of our, especially older churches, don't do very well in that category. The mental and psychological behavioral side of it, studies generally show that all of us, as we get older, there's a cognitive capacity decline in attention and memory and processing speed, which is what I was talking about a second ago. And that just means it takes longer. It takes longer to find where we are. It takes longer to learn. It takes they don't memorize as quickly the music that they've learned already, and those kind of things. So you just have to give it a little more time. Let me shift from what's happening with the singers to some of the things that we do about it, as far as the choral issues. And I'm looking at my time here, so I'm going to move along and try to keep us within the time frame here. But the primary issue that I think most of us deal with is what's happening to the blend and the tone of our choirs, and that is primarily because of vibrato, and in some cases the timbre or the tone. The solutions to that, unfortunately, are not a bag of tricks that I can give you that you may not already know, because it's generally a lot of the same sorts of things that you already do in a choral setting. There is the physical placement of singers within the section, the acoustical properties of how voices work together, voice placement, whatever you want to call it, and moving people around so that their voice is either blended into the sound of the ensemble, or in some cases hidden in the ensemble if that's what you have to do, or at least minimized if when that has to be done. And it helps, in terms of what their experience and how well they hear and intonation and those kind of things. And there's books and articles written on that. But frankly, over the years that I've been a conductor, I've learned a few principles for voice colors and types and how to place them. But I would just say most of the time it's trial and error. I try a few different things until I find one I like, and there's certainly nothing wrong with that. But physical placement of the singers can help with the blend. Volume control, I ask them to focus on not over singing, well, like we said, due to hearing difficulty. And then longer warm up. And I know that's hard. Nobody wants to hear that because we just don't have enough rehearsal time as it is. But the exercises that we do, especially for the older singers, are really important because of the challenges that we've already mentioned in terms of their breath support and their phonation time, and even just getting the body kind of opened up and ready to sing so that they can expand on what they do have in their abilities. And I want, other than the exercises I'm going to tell you about later, any of the exercises that you know from warm-up books or your own experience, I think are good. But generally, I'm going to focus most of my time with the older singers on exercises that emphasize breath warm-up, breathing exercises, and then sustained sound exercises. I may do one of the sort of go, up and down, highest, lowest range type of warm-ups. But they're going to get a lot of that in the rehearsal, in the music that you're doing anyway, if you plan the rehearsal well. So for the older singers, the most important exercises in terms of warm-up are breath and sustained sound. One of my favorite is just to pick a pitch sort of in the middle of the range and have them sing up to 8 and then back down to 1 with a soft to loud to soft. Sort of a 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 7 and 6 and 5 and 4 and 3 and 2 and 1. And I really try to focus on making them do that in one breath with the dynamic change. And you can, play some chords underneath it to make it interesting, or allow them to hear the acoustical differences of where that pitch is in a chord structure. If you want to, and that makes it more interesting. But that's one I use almost every rehearsal, as well as just regular breathing exercises. Range modification, especially for tenors and sopranos. And I think about this in these 3 terms: revoice, rewrite, and reassign. Revoicing is dealing with the harmony. Rewriting is dealing with their vocal line. Reassigning means moving somebody to a different part if you have to, or a group of somebodies to a different part. You can easily revoice a song and not create too much of a problem. If you've got, just add a note. If you've got an open SATB chord and you want to add a baritone part, and you can balance that and allow some of the people who are having trouble with the note that's actually written, just move them down. Rewrite the melody. Now, obviously, you can't rewrite the tune of a familiar song or hymn, but you can certainly rewrite the tenor part, or you can rewrite an alto line, or so you can add a second soprano line that doesn't go up to that F that half of them aren't going to be able to hit. And I do that all the time, with my apologies to the composers or whoever wrote the song. They just have to understand. And then reassign. that's where you're dealing with individuals, and I know how tricky it is to tell a first soprano to sing second soprano. You must handle with care when you do things like that, but there are ways to do it, and one of my tricks is to tell the soprano that can't really hit the high notes anymore that, boy, the seconds are really having trouble with that. Would you help them, because they need some help learning those notes? Or another thing that I like to do is that we'll hit a big chord and it's not quite there, and so I just say, you know what, the balance is wrong. That chord is really top heavy. I need 3 sopranos to sing the second soprano note there, and I want it to be you, you, and you. And then I just move on without giving them a chance to do comment. But at least it's not saying, you know, you blew that note, you can't sing it anymore. Intonation, especially breath support related. Use of movement and kinesthetic imagery is really important. Visuals and verbal imagery, constantly with the older folks, they tend to go flat just because of the breath support problems that we have. So if you can do the descending line, I want you to take your hand and stair step up as you sing bum 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 bum. Make those intervals smaller. A descending interval. I'm always telling them to put that second note up on the top shelf. Don't throw it into the basement, because you know you want to say, well, they're just being lazy singers, and sometimes they are. But there is that issue of breath support that creates those intonation problems. You need to do larger, clearer breaths preparations as a conductor. Breathe the way you want them to breathe, and it needs to be full and deep. If you're using your hands as a conductor and gesture, you want to gesture with the kind of things that give the proper breaths for the older singers. I think one of the most important things is don't talk during the prep breath. The beat that they're supposed to be breathing on, you don't need to be talking, you need to be breathing. And you can try this, but I remember a children's choir specialist the lady who I love, and I learned everything I know about children's choir from her, but she would get so excited sometimes when she was working with the kids that she'd kind of go, a 1 and a 2 and a sing right now. Well, nobody's ready to sing if you do that, because instinctively, we are not going to breathe while you're saying something to us. And so you know the easy way to fix that is you pick the beat before you want them to breathe, and then you breathe with them. 1, 2, la la. If it's on beat 4, if it's on beat 1, it's 1, 2, 3, bum. And eventually you get to the point where all you have to do is say that one beat, take the breath, and go 2, bum bum, and they're going to follow you. But they're also going to breathe correctly, and that's so important. It's more important for the senior singers. Facial expression and resonance. This is something because of what's happening with the facial structure that I've already told you about. You're dealing with the thinning of the soft palate. You're dealing with hardening of the uvula even as we get older. And you're dealing with the angry resting face that you sometimes get from choir members, especially the older choir members who are just kind of look angry. And so while it is part of showbiz to have an uplifted face and raised eyebrows and to communicate your face, it also has an effect on the sound. One of the exercises I love to do with the choir is, and you can do this with me right now, is if you frown and you furrow your eyebrows and you look mean and angry at me, and you hold that for 5 seconds, 10 seconds or so, you're going to start to feel the tension, not just up here, but you're going to feel it on the inside of your mouth in your soft palate area, because everything's being pressed down. The blood's being flown into that section because it's tensing up. That tenses everything about the singing process. So we want to get people to relax, smile with their eyes, and do the sort of showbiz side of it. Will have an effect on the resonance and the tone, the timbre of the voice, whether you're old or not, but especially because that's something that the older folks deal with. Stamina, standing and sitting, moving, processing. These are things you have to think about and deal with. You need to give people permission not to be part of that processional if they have mobility issues. You need to be careful about how long you're asking them to stand. Within a concert, are there times for sitting and breaking and things like that? Um, Retention. You're going to, with the older singers, you're going to have retention problems. What we can do from Wednesday rehearsal to Sunday morning is way different than when I'm dealing with the choral society or the Knoxville Chamber Chorale. Um, there's so many Sunday mornings I come in and I go do the one run through of our anthem, and it sounds like we've never seen it before. But be patient, do it again, and then it starts to come back, and you'll see that with repetition, they haven't lost everything that you worked on Wednesday night. But you do have to be aware that that is an issue with older singers. They will remember, but you have to be patient, and you have to do repetition. You can devise systems and codes with the older folks that work for your individual situation. There's I can remember I had a lot of engineers in a choir when I was in Tuscaloosa because of the Mercedes plant that was there. And for me to tell them to go to mezzo piano to forte, that didn't work for them until I came up with a number system that says, okay, I want you to go from dynamic 2 to dynamic 7 in 7 beats. Okay, we can do that. So be creative about how you talk to your singers and come up with, marking, blue pencil, red pencil, the kind of things that will help them remember as they're singing the music, the work that you've done. Very important. Medical emergencies happen when you're dealing with older singers. In our church here at Tellico Village, we probably have, I know we've had one every year. We probably have 3 to 4 medical emergencies a year and during worship services. And thankfully, most of the time, it's not serious. It is sometimes, but you wouldn't believe how often it's just that somebody didn't eat breakfast that day, they've sat too long, and then they get up at the end of the service and they just wobble and they're out. As the conductor, as the church musician, it's not your job necessarily to come up with an emergency response plan, but you need to have one. Your church needs to have one, and you need to know it, whether it's at your rehearsal or in the middle of a worship service, because when a medical emergency occurs, everybody who's in that choir is going to look to you for leadership. They're going to look to you to know what to do, and you can't be running around panicking and going, oh no, what do we do? You need to be the leader there and at least know what your medical plan is. Know who calls 911. Know when it's okay to move somebody out and continue on with your activity, or when they just need to stay there and let the medical personnel deal with it. Those are important questions. If you dismiss everybody and they all go to the parking lots and are flooding out of the exits as the medical ambulances are trying to get in, you've created a problem. So talk to your church leadership about what the plan is and make sure you know it, both for your rehearsals and in the middle of worship even. I'm really short on time, and I know that, and I've talked a lot, but I want to go quickly and tell you just a little bit about the exercises that I use for my research because I think they can be helpful. These are exercises that are primarily intended for individuals, not necessarily something that you're going to do with your whole choir as a warm-up. They're not singing exercises, they're vocal exercises. As I said, they come out of the vocal therapy area. They're called vocal function exercises, and they were developed by Dr. Joseph Stemple as part of a physiologic approach to voice therapy, and they're designed basically to re-strengthen and coordinate the laryngeal musculature and rebalance the relationship between the systems of voice production, which are respiration, phonation, and resonance. They're divided into 4 parts. They're based on exercise physiology, so it's the same kind of thing. I often tell my singers that the whole vocal mechanism is the same as any other joint in your body. It's made of the same stuff, cartilage, tissue, blood vessels, muscle, those kind of things. And so any exercise we do to keep those active is helpful, whether you do it every day or a little bit. But this is an exercise regime that's based on warm-up, stretching, contraction, and power, which is exactly what your gym teacher would tell you to do if you're a weightlifter. So here's what we did. We took these exercises that Dr. Stemple had done, and I had amateur singers over the age of 50 who performed the exercises twice a day for 5 weeks. And we tested them both objectively and some kind of technical stuff with graphs and things like that I won't go into. I'll show it to you if you want it. If you want to go that far, I'll send it to you. But we tested them for vocal range, and it showed that almost 77% showed an increase in their lower range, and 61.5% showed an increase in their upper range. We tested them on maximum phonation time, and all but 2 of the subjects increased their phonation time, how long they could sustain a sound, from anywhere from 1 second to over 13 seconds. And then we tested them on vibrato, and each subject showed some change in vibrato, which is measured in rate and extent. Vibrato rate on a graph is the speed at which the waveform goes. The extent is the actual pitch from high to low that vibrato has. And they showed change, but ultimately the results, when we did the analysis of variance tests on that part of the data, it didn't get to that point where we could say it was statistically significant. So there was some hint that if we had had a larger sample size, it was moving in that direction, but we never got to that, sort of 0.05 threshold where we could say this is statistically significant. The subjective test, though, we had professional choral conductors rate them and blind listening to the subjects, and they showed that they perceived improvement in the singer's vibrato extent, the intonation, the tone, the breath support, projection, and consistent. And these were experienced conductors listening to pre and post exercise test recordings. And then the participants themselves did self-evaluations, and 88% of the participants perceived improvement in the quality of their voices, singing voices, and the singing experience. And so that was the crux of the research that I did in my DMA. And what I've given you in the handout is the actual vocal function exercise instructions, and there's a log sheet. And you can Google this because they are widely used in voice therapy situations. So when you have somebody that comes to you and says, I'm having trouble with my voice, and you need to give them some resource, this is the primary one that I tell people about, are the vocal function exercises. There's videos on YouTube and other places that show how to do them, or Dr. Stremple, I think, sells a DVD that actually walks you through the process of doing them. And I'm sorry that I'm out of time now, but since it's online, I won't demonstrate all of them for you. But they're basically 5 little things that you do with your voice, and you time yourself to see how long you can do it. One of them is singing the sound in a very nasal sound that sort of takes the pressure off the vocal folds and puts it right here and allows you to sustain that for as long as you can. There are 2 slides, one that goes from the lowest sound you can make to the top, and from the highest to the bottom, on the sound O, all the way down, and then you do the exercise on that same vowel, where you sustain it on different pitch levels that are prescribed in the instructions that allow you to do that. And you're gonna do that and hold it as long as you can. And for those who really want to know their progress, you can time it with a stopwatch and see how that goes. Anyway, look at the handout that I gave you. There are instructions for how to do that. I've got a pretty good bibliography on resources on vocal aging that you can look to if you want to. And of course, I'm available if you want to send me an email or give me a call to talk about anything specifically related to this. I'm sorry I went a little bit long, but thank you very much for having me. You can tell it's something I'm kind of excited about, and I was really happy to be a part of your evening tonight. So best wishes to you all. I hope you all find ways to let people sing for as long as they can and want to.